a good candidate coming through our doors is generally somebody that's just they're tired of losing this battle of weight loss. And they may have even tried weight loss medications in the past, and there's been a number of different medications available, and many of which we actually prescribe in our clinic and use commonly for people. But it doesn't always work for folks the way they anticipate it. Some people have a lot of side effects that are just not desirable with these medications, and it also can get expensive depending on how they are buying them. Typically, surgery is comparable to about 2 to 4 years of medications. So for having a much longer effect with that single event, rather than having to continue on this dosing these medications for life. So the perfect candidate comes in frustrated with these experiences and not really achieving, not really achieving their weight loss goals, or maybe it's other health problems. I think diabetes is a great one. That is, if we can impact diabetes, we are changing the world. So it's exciting to see people coming in with, type 2 diabetes and just wanting to live a healthier, better life. They have goals of not really being skinny, because I really try to push people away from that, but just a healthier you. These people want to be able to lift their grandchildren and maybe take trips with the family, be able to put their carry-on luggage in the overhead compartment on the flights. To somebody that doesn't struggle with obesity, it's hard to imagine what folks are going through. The amount of judgment they encounter when they're getting on a flight or going to the movie theater. It's no wonder so many people find themselves isolated and unable to engage in those social outlets, because this whole thing then snowballs. They're more isolated, they're more depressed, they get worse, and so this really has given us an opportunity to help these people break out and get their life back. So when people ask me about the types, how their lives will change after surgery, it's this is the reason we have a 3 to 6 month plan, because I want lives to change before surgery. And there's different places you can go. You can fly to Mexico and get a sleeve gastrectomy done, and maybe that'll be great. It'll be a nice long weekend. But if you don't implement the changes, you are not likely to succeed in the long term. And this is really important for us. We want people to be empowered to succeed. And so we have a process, and that involves getting involved in fitness, no matter what level. Like, say your legs don't work, you got your arms. We work with what we have and get them to a better point. Making better dietary changes, working with our psychological staff, our nurse practitioner, and our dietitians. Everybody kind of works together to help these people get to where they need to be, to where it becomes a little bit enlightening in terms of like, oh, this is the kind of food I'm going to be eating. This is how I'm going to eat. And that way, after the surgery, it's not such a shocker. So there is an adjustment period that after surgery, we have to control the diet a little bit. So, first few weeks, it's a liquid diet, and then we go to a soft diet. And ultimately, by 2 months out, you're liberated. You can eat what you want. But by this time, you've had so much education and encouragement to eat properly and to engage in fitness that now we have our most successful candidates come out with a consistent pattern of behavior. They're doing fitness 5 times a week, might be twice a week doing some resistance training, and 3 to 5 times a week doing some cardiovascular work. And it's not like they're killing themselves on the treadmill, right? They're out there walking and talking with their friend or their partner, and they do that for 30 minutes, and that knocked off one day's workout, right? And they had a great conversation during it. So it's not like it's so tough. It's just about pattern, about behaviors, and getting engaged in that. So in terms of being able to have a successful outcome and how that changes your life, most of those changes are already there by the time you get to this point. For people that are looking for the next step to engage in a program like this, our doors are open. They can call in and set up an appointment, and they'll have a phone conversation with our coordinator, and I'll just making sure that we're going to be able to help them with their goals and that everything's in line for that. But we also really like to partner with people's primary care. We find that when we have a expansive health team involved in that person's life, that it helps them with their outcomes, it helps them feel more comfortable about what they're doing and know that they have different places they can go for help when they need it. So we encourage that they seek their primary care's input on that as well. But we are always happy to discuss it. And to be honest, not everybody is right for surgery. And so we offer medical supervised weight loss. So we do that. And it comes down to their goals. So really understanding what it looks like in terms of what's realistic based on the modality that you're picking. We help people understand that so that you're not disappointed by what you achieve. I mentioned these people feel isolated, and I told you at first I'm a general surgeon. Done that for years. I love it. I love all aspects of surgery, and I just like helping people get to a better spot. It was super impactful to me when talking to a gal with a bad hernia coming through my clinic door, and just asking her if we could talk about her weight, because that was a huge contributor to her problems with her hernias. And when she opened up, nobody had ever talked to her about it. She was probably 200 pounds overweight, and overweight, a lot of it centrally, and then pushes on the abdominal wall. So it's just, it's kind of, we've let people down in a sense as providers, where we've kind of brushed this part under the rug. It's uncomfortable. Nobody really wants to talk about it. Of course, they already know it's a problem. Why address it? These people need to know they have options. And this gal was crying because I told her that there's help for her if she wanted it. And she ended up being one of the early starters in our program. So I think people need to be encouraged, both providers that are taking care of patients on a daily and patients themselves, like, just get in and talk, just ask and see what help there is for you, because you'll be surprised what you can find, and you'll be surprised at how happy people have been coming through this. And to tell you that it's easy would be a lie. It is very challenging. It is not a shortcut. It shouldn't be viewed as that, but it can be a life-changing decision. So I would encourage people to just seek an answer.